Hi everyone. Today I want to talk on inequitable access to healthcare, vaccines, and medicine. Um, when you hear inequitable access to healthcare, what comes to your mind? What does that, does it ring a bell to you? First I'm going to define inequitable access to healthcare. According to World Health Organization, 2018 report, it says that health inequities are systematic differences in the health status or in the distribution of health resources between different population groups. Do you know there are some parts of the world where health care services it's zero to none? There are parts of the world where people find it difficult to access health care, to go to the hospital when they are sick, to go to the clinic when they are dying, or seek for an emergency or urgent services. There are some communities that are being exempted when it comes to health. Now, this group of population is actually the whole definition of health inequities. There are social determinant factors that contribute systematically to these health inequities. Social factors like low education, low socioeconomic status, unemployment, religion, and gender. Now, these influences people being unable to access health or go to the hospital when they are sick. As a medical doctor, I've been in the hospital and where patients comes to you and then they know that they don't have the fund for these medical bills, but because they know that they need it, they need to get well, they need to be attended to by a doctor, by a nurse, they need to run some tests. And at the back of their mind, they have this belief, or will I say superstition, that somebody's going to come up and pay the bill. And majority of the times it works. So majority of the times it doesn't work. Health inequities is more common in Nigeria. Yeah, Nigeria is one of the countries where health are not being distributed equally. It's one of the countries where people suffer because of ignorance, because of neglect from the government. You know, um, Nigeria is one of the countries that even if there is a hospital in the community, you might not see a doctor, you might not see a nurse, you might not even see a lab scientist or a technician to run the test and then figure out what is the problem or what is the cause of the illness. World Bank and World Health Organization in 2017, they come up with a study, and this study shows that at least half of the world's population does not have access to healthcare, vaccines, medicine. Can you believe that? You that is in other parts of the world, or you that can afford or can get access to healthcare, you don't know how lucky you are. Believe me, you don't know. There are thousands, there are millions of people who cannot afford it. And there are millions of people, populations, who does not have access to healthcare. They don't have access to vaccines. They don't have access to medicine. Now, take for example, during the pandemic, the COVID vaccine came out, right? I know some people, it took them years or months to be able to get it. Why? Because it has to start from the top. The 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 bosses have to get the vaccines first before it goes or before it comes down, to the other populations. So and they estimated that each year about 100 million people are being pushed into poverty because of healthcare expenses. And currently, 800 million people spend at least 10% of their budgets on health issues, forcing them to survive on just $1.90 or even less. Nigeria is one of those countries. I am pretty sure that majority of Nigerians they live on less than $1. I am pretty sure about that. Now, how are they going to be able to pay their bills? How are they going to be able to pay their medical bills? You see that there is a very big problem when it comes to health. There is a very big problem when it comes to health services, healthcare. There is a very big vacuum. There is a very big gap when it comes to anything concerning health. And there are consequences, when you're not getting a good healthcare services. There are consequences, right? One of the consequences, or some of the consequences, are the communities are deprived the sense of well-being. When you are not mentally functioning, automatically your body cannot be able to carry you. You need to be fit mentally for you to be able to work. So when the communities are deprived the sense of well-being, it decreases productivity. It decreases quality of life. And if you watch now, there are high cases of mental illness, especially in Nigeria, because people cannot be able to access health services. Like I mentioned earlier, there are populations, there are group of people, certain group of people who are even worse when it comes to accessing healthcare. And these people are people with low socioeconomic status, communities that are underserved, sexual and gender minority groups. Sometimes when you go to the hospital, there are some certain things they look at you, they go, because you are a woman, okay, because you are a man, I'm not going to do this, I'm going to do this. So those are things that contribute to health inequity. Then objective of this is to improve the finances of low income earners, which is a key social determinant factor of health. In my next slides, or in my next topic, I'm going to be dealing on probable novel solutions that could help some of these countries or some of these nations. So here are my references again, because I don't do plagiarism. Everything I say, I reference them, and then I insert in-text citation, because they say give respect to whom respect is due. Thank you so much. I hope you enjoy these slides.